Right, good afternoon, everyone. Thank you very much for joining us for our Impact Accelerator webinar and sandpit. So I'm Sarah Knowles. I'm a research fellow in knowledge mobilisation at University of York, and joined by Rach. You could just introduce yourself.
Yep, Rachel Churchill. I'm a Professor of Evidence Synthesis at University of York, and I work alongside Sarah on the knowledge mobilisation work for Closing the Gap.
Yep. And we have Tianu, who is our technical mastermind, making sure that we don't delete Google or anything else silly while we're trying to do this. Okay, so quick overview. So the first part of this is a webinar format. So to talk about the remit of the Impact Accelerator Fund, some suggestions to bear in mind, the kind of definitions to use, things we'll be looking for. A very brief, what I'm calling an evidence snapshot, just the kind of knowledge mobilisation evidence base pointers to be aware of if it's something you're not that familiar with. And then at the end, we will stop recording and we'll have more of an opportunity for a Q&A. So I think you can drop comments in the chat then, anything that comes up as we're going through. We'll then have a break, and then we'll be coming back. You'll get a different link. We'll come back into this and you'll be given another link by Tianu to join a Zoom session where we can have breakout rooms. And I'm calling that a sandpit, and it's really just a bit more space to reflect with other people who've joined today and with us there as well. And I think particularly if you've got ideas that you're thinking this would help if we had additional material, or maybe collaborators with some additional ideas, it can be a good place to meet people thinking along those lines. That is very much kind of an optional time though. And if to give us a sense of numbers, if you can, while I'm going through the webinar, drop in the chat if you are intending to join us for the sandpit, so we've got an idea of how many people might be coming to that. So first off, a couple of important dates for this call. One is the kind of sister workshop to this, which is led by Emily Peckham, and she'll be going through the technical details of the application, talking about the funding structure, that kind of thing. So all of the kind of pragmatics for how to really recommend that you attend that workshop, and you'll be in the best position to know exactly what you're doing as you start putting your application together. And obviously the key date is the application deadline, which is Monday the 20th of December. So this is the Impact Accelerator call. It's for work to do with what we call in the network knowledge mobilization. Now, there's a lot of different terms for this that kind of fly around. There's knowledge exchange, knowledge translation, knowledge transfer. And the point that we want to make is that we're very pragmatic about this. We care about what you do, not what you call it. Our pragmatic definition here is that knowledge mobilization is working with users to make research that is usable and useful for them. So don't worry too much about terminology. If the thing that you're thinking of accelerating is based on work with a different funder that use the term knowledge exchange, that's fine. Put a line in, explain, we call this knowledge exchange, that's what we do. If you're working with someone as a collaborator whose title is an impact lead or a knowledge transfer position, use that terminology. That's not the important thing for us, so don't worry too much. We're not going to try and trip anyone up by saying, haha, secret, you said you're doing knowledge translation, knowledge mobilization is entirely different. What matters is what you're doing, okay? So don't worry too much about the terminology. The remit of this call, we're looking at accelerating findings, okay? We're looking at getting impact out of evidence, findings that have been produced by research. So working with stakeholders or partners to co-create new research is not within the scope of this. I feel now when I work at knowledge mobilization, my take very much is that it really is about co-production, co-design, and working with stakeholders from the beginning as soon as possible. So that kind of work is hugely important. So I'm definitely not saying that working with stakeholders to co-create new research isn't under the knowledge mobilization umbrella. It absolutely is. But there are other sources of funding for that. And what we identified in our work over the past few months working with different Network Plus funded projects in closing the gap, was that a lot of the time people get to the end of a study, they've got some really great findings, or they've got some really interesting evidence they want to get out there, but their funding's ended, for example, or they've realized that actually they do need to do quite a lot of work with stakeholders, or they need to fund some of their own time to get the best out of this. And there's a gap there, really. People then are struggling, they want to do this well, but they don't have the funds to support it. So that's the specific gap that we've identified here that we want to help out with. So as I say, entirely kind of co-creating new research, just doing, say, general priority setting or something like that, even though I would consider that very much knowledge mobilization, it's not fundable within this specific core. There is a section on the application form. We talk about kind of sustainability and legacy. And I think if you're forward looking, if you're identifying avenues for future work, future research on knowledge mobilization, that's really great. We would absolutely encourage that. But we are looking for defining impacts that can be achieved within the timescale of the project, which I think they can run up to 9 months. Okay, so if it's just kind of laying the groundwork for something in the future, that might be a little bit dicey. You really need to talk about what you're going to be doing, what defining the impact that you're going to have within that 9-month period. Can I ask Rach and Tianu, if anyone drops anything in the chat that's a request for clarification on the slides, yeah, do tag me. Okay. More advice on kind of the remit and on the things that we might not consider, I guess, is the easiest way to frame that. If you're asking for cost purely to kind of disseminate research, purely to push research out there, without evidence of what we're calling a knowledge mobilization strategy or of some evaluation of impact, that again, we won't consider that eligible. We're not here just to kind of fund that activity without any kind of strategy around it, without any evaluation around it. And when I refer to a strategy, that can be any one of these things. So working with your intended knowledge users, the people you want to use your evidence, that can be the strategy, you know, understanding what they want, what they need to hear. Collaborating with partners with expertise or partners in a different field who've got skills relevant to this. Drawing on knowledge mobilization frameworks or looking at a knowledge mobilization evidence base and saying, okay, we're going to try that particular strategy because we think that might work. Comparative evaluation would be great to see. There's really very little there that kind of talks about how different, for example, dissemination outputs, if you do something, push something out through on a network mailing list versus you put it on social media, do you get different levels of engagement? Do you get different kinds of audience engagement? We don't have a lot of evidence on that at all, so something like that would be fantastic to see. And acknowledging that in a more formal sense, thinking about knowledge mobilization strategies, there are frameworks such as ERIC, which is for implementation science. It may be appropriate for you to be pulling out particular implementation or intervention strategies. I kind of suspect that within this period for this funding, that's probably not going to be the case, but it's a suggestion for if it is relevant to you. So what we will be looking for, what we're going to look to see, we want you to specify what we call the knowledge user group that you're going to work with and why. And what is really important here is that a lot of the times, partly because there isn't enough funding at the end of projects, I think researchers can try to create products that are one size fits all. You know, we push something out and we go, oh, it's meant for professionals and patients and clinicians and researchers. And actually the evidence for knowledge mobilization would say that that doesn't work. Actually, what you need to do is tailor your products specifically to particular audiences. So if you do say that you're going to be reaching, multiple audiences, we'd kind of want to look there at, well, do you have a strategy for how you're tailoring this differently? Is it that you're comparing between those audiences? Essentially in, those impact statements that just say, we will disseminate this to patients, the public, clinicians and stakeholders. We're not looking for that because that's the problem, that these things are way too broad. And of course, a lot of the time, the kind of the sort of cry that I get from researchers is that, but we don't have enough resource to do these different products. That's what this call could be for. That's what you could use this money for. It's to actually give you the resource to be able to do that tailoring work. Your project could be about working with that knowledge user group to understand what that user group needs. That would be within remit. So, because a lot of the time I think we make assumptions or we just haven't really thought through what those audience needs might be. So it could be about working with a group of representatives or with a network to say, how do we best reach clinicians through, who should we be talking to? How does this information need to be presented to be most relevant to patients? So it's about specifying exactly what you're doing and who with for what impact. And it can, we give the example, I think, in the sort of the pack, the materials, that you don't have to be mobilizing your own knowledge, if that makes sense. This doesn't need to have been, you've done a study and then you want to take forward the findings from that study. It could be that actually you're really interested in a particular audience. So say you're really interested in patients, the group I work with most, and I want to work with patients to understand what they would get out of studies about trials or something like that. You can engage that user group with that evidence base, thinking about what is relevant and valuable to them. That would be really, really useful work, and that would be about building a knowledge mobilization strategy tailored to that audience. I mentioned that we want you to think about the kinds of impact that you can have in this kind of 9-month time frame. We will look for whether you have a definition of impact. How are you defining impact that you say you're going to have? We want you to be realistic. So if you say, I am going to change practice across England and inform the NICE guidelines, unless you've got a very specific kind of strategy for who you're informing to do that, that kind of thing is probably going to not be achievable. What I want to get at here is that actually, when we think of impact, we can be thinking that further down the line, those actual changes to practice and measuring those. But what we can often neglect is that just getting evidence in front of people, getting them to engage with our findings and talk to us about it, that's impact. That is part of that process. And actually that needs to happen before the later elements can come true, can come to fruition. So there are some frameworks that you can use, impact reporting frameworks, which help you kind of to define those as impact, to say, we are going to do this kind of collective work, we're going to consult these stakeholders, we're going to look at how people engage with the evidence and what they think about it. They are all valid kind of things to capture and report as impact. You can talk about how you think this might go longer term. So we've got the example of identifying champions or creating legacy outputs that could be hosted and how you'd monitor engagement with those. But just define your impact, define how you're going to measure what impact you're going to get within the 9 months. That's what we'd be looking for. So I mentioned there's a couple of examples, so just as a couple of pointers here. One is the Morton, this is called the contributions framework. And as you can see, splits this into these 3 levels: research uptake, research use, research impact. And you can see that here in research uptake, so research users just engaging with the research, reading a briefing, attending a conference, involved in advising. They are valid impacts, and you can use this framework to report that, capture that and report that as an important part of kind of a longer strategy that's a pathway to impact. If you can talk about how people use your research, so do they, and again, I like that these are quite feasible. This isn't they use it, I can see a change in practice. This is, do they pass it on to others? Does it look like they're adapting it? Are they talking about how that evidence is going to become part of a future policy or future working for them? Those kind of things, if you can capture, are fantastic examples of impact. Another example, this is Vicky Ward's framework for knowledge mobilizers. What I really like in this one is that she actually talks about whose knowledge is being mobilized. And I mentioned that this work can be about working with members of your intended user audience. So this recognizes that an impact can be understanding, bringing patient knowledge, for example, or clinician knowledge into a strategy. The impact you're having then is that your plan for research is changing because it's being influenced by your intended users. So you can capture and report that as impact. And in terms of how, again, having, I think, a really useful but feasible kind of categorization here. So connections, making connections with the right people. How are you getting your evidence in the room with the decision makers? That's a really important impact. Do you have specific dissemination strategies or platforms? Where are you putting this information? And then more actively, are you doing kind of facilitation? Are you doing more kind of participatory working or learning sets with people? But it's recognizing all of those different kinds of activities are impacts. They're really important and useful, and we should capture them. This is a kind of what are called K&B evidence snapshot. So one of the reasons we're encouraging this is that there isn't the evidence base for kind of knowledge mobilization and dissemination, I think, is evolving. It's getting better over time, but there is a big gap there, you know. It's this kind of irony that we do not share evidence in evidence-based ways a lot of the time. And so that's why we're encouraging this kind of work and the reporting of it to say what works when you're sharing evidence, what works when you're trying to get things to impact. But there is evidence out there a lot of the time about what doesn't work. I think it's probably fair to say. And just to kind of give some pointers about what that is. So firstly, there's this difference between what we call active and passive dissemination strategies. So a passive dissemination strategy is just kind of putting something out there without any additional effort. And sort of colloquially, it's called the field of dreams error, which you'll show your age if you know that, because it's that if you build it, they will come. So, you know, I've put it on a website. So what would be the answer then? How do people know they're meant to be getting to the website? Whose website is it? How many people are accessing it? Thinking about this in more detail. So what we find is that more active strategies that involve directly communicating, engaging with people tend to be more successful. So that might be something to bear in mind. If you're just saying, I'm going to create something and sort of put it out there, you know, is that necessarily in line with the evidence base saying that those kind of strategies can really struggle? In line with that, kind of thinking, how do you get these things to people to hear about them? Thinking about champions, thinking about how you use existing networks. Who are the influencers? Who are the people that your audience listen to? Obviously, a good way to find that out is to ask them. Who are the people that kind of you bear in mind when you're making decisions? Who are the people that you pay attention to? Have you got ways to reach out to them and speak to them? I get asked about social media quite a lot. And I think it's interesting that social media, there's very little kind of real evidence at the moment about what the impact of using social media to disseminate is. And a lot of the time, I think we've got missed opportunities because we tend to, where papers have evaluated social media, they've still done it through this very somewhat limited, I think, academic lens of, you know, if I tweeted it, how many article accesses did I get? Whereas I think social media can be really interesting for how it engages different audiences, for how it promotes conversation and feedback, those kind of things. And if you consider the success of, some of you I'm sure have heard of the mental health website, which provides accessible summaries of mental health studies, hugely kind of popular site, tons of engagement, tons of interaction. That's the kind of stuff that I think is really interesting around social media, but we don't see a lot of analysis of that kind of thing. I've already mentioned this, but really all of the evidence points to the need to tailor things. You need to tailor things to the context they're going to be used, to the particular audience, to what is needed. So a lot of this stuff needs to be bespoke. It needs to be sort of actively produced to meet people's needs. And the way to do that, the evidence would suggest a lot of the time, is through co-creation. So working with your users to make sure you're not making assumptions about them, to help kind of access their knowledge about what they need and where they work and how they work. And there are various sort of methods being used, think aloud methods, or iterative design, creative methods that encourage people to share the expertise and knowledge that they have. There's some really interesting work out there on that. And then the last word here, this is my slightly skeptical kind of discussion. So if you work in knowledge mobilization for long, you get very skeptical of the word toolkit. And I have a colleague who did a PhD entirely on toolkits, and part of the problem is that anything and everything has been called a toolkit at some point. It kind of became a bit of a thoughtless way to try to say that a bit of material that you had was somehow more actionable and useful. You go, oh, it's a toolkit. I don't have anything against toolkits per se, and there are some fantastic examples of toolkits out there, but they tend to have been ones that have been worked up with user groups, that have had some kind of testing of how people access them. You can't just put the word toolkit on it and it doesn't make it actionable. I have exactly the same rant about apps. Okay, I don't think anyone will be developing an app in 9 months for this amount of money, but similarly, an app does not automatically mean usable and engaging. You need to sort of describe that. You need to give us the, you know, think about what it is people are actually going to do with this, and do you have evidence of that? So that was a very rapid fire kind of introduction, but I hope I've kind of given an overview of the kind of work we're looking for, and given some pointers to those of you who maybe are new to kind of knowledge mobilization or knowledge mobilization research. I think what we'll do now is stop the recording, I think, Tianu, and do a bit of Q&A if anyone's posted any questions in the chat or would like to.
Yes, that's it. Yeah.
Yeah. So any questions?